I think for environmental observations and interviews, you really have to understand the patient journey right from that moment at home where the patient might realise they're in pain or some discomfort, or they suddenly think that maybe they should be participating in oral health. We also reviewed what happens when someone phones in for assistance. So there'd be telephone calls with a receptionist or a patient care assistant. There were also walk-ins where people actually had concerns, either pain or just discomfort.
Before we undertook the observations, we looked at the patient journey. We walked through the hospital. So there's two main entry points into the hospital. The letters we found out, well I found out, encouraged people to park in two places. The primary one was in our underground car park. The other place was outside the actual children's hospital clinic, the Grace Neal block, but had identified that there were very limited car parks. So what we did was we then made the journey from the car park up into the main hospital, and then I followed a person who did not know their way around the hospital to the clinic, and that was actually quite an eye-opener for me, having worked in the place for over 30 years. It's made me realise that you get used to the quick routes, the route to the place, and although there may be signage, whether it's useful or not, you don't take any notice of it because it's always there. We made our way into the actual outpatient clinic, and we sat there and observed people waiting, the interactions with the parent and the child, the parents and the clinic staff, the admin staff, and then the meet and greet process to get them into the actual clinic.
The receptionists are really vital people in how people are invited into the environment, how they're received, how they're welcomed, how they're guided to where they need to be, the noise, the clutter. If it's a calm environment, it sets people up for a really good time with the healthcare professional they've gone to see. If it's chaotic and busy and a lot going on, the environment as a whole with what's on the walls is part of that. We visited several areas, and there was huge differences. Some areas were very clean and tidy, as in not lots of clutter on the wall, and others had lots of old information on the walls and lots and lots and lots, and you didn't know where to look, and it actually was just a bit overwhelming.